A 3-year-old with a respiratory tract infection received amoxicillin 30 minutes after first dose. Urticaria appeared on the skin without any other symptoms. Management. Allergic reaction due to amoxicillin should be treated by antihistamine like diphenhydramine or cetirizine. Likely to penicillin, allergy remove causative factor. Stop taking penicillin even if there are no symptoms. You don't want to exacerbate them, as in some cases it can lead to anaphylactic shock. Assess and monitor patients to make sure their condition isn't deteriorating. Make patients aware of penicillin allergy to prevent it in the future. Rash should disappear within 24 hours of stopping amoxicillin. Refer patient in the future to test for true penicillin reaction test, as this may not be a penicillin allergic. For example, associated with Epstein-Barr virus instead of, or the respiratory tract infection is associated with it instead, or other food allergy antihistamine to relieve hives and itching. Evaluate need for antibiotic in this respiratory tract infection. If needed, change to another non-penicillin antibiotic, for example, cephalosporin. So, management of urticaria following amoxicillin administration in child, especially without other systemic symptoms, primarily involves discontinuing the antibiotic and providing symptomatic relief for the allergic reaction. Here's a detailed approach. Immediate management: discontinue the amoxicillin. Immediately stop the antibiotic as urticaria indicate an allergic reaction to the medication. Administer antihistamine. Oral antihistamine, for example, cetirizine, loratadine, can be given to reduce itching and deep rash. These medications are generally safe and effective in children. Observe for other symptoms. Closely monitor the child for any progression of symptoms, particularly those indicating a more severe reaction like angioedema, swelling of deeper skin layers, or anaphylaxis. A life-threatening allergy reaction involve multiple body systems. Follow-up management: re-evaluate antibiotic need, assess the necessity of antibiotic therapy for the respiratory tract infection. Many respiratory tract in children are viral and may not require antibiotics. Alternative antibiotics: if one antibiotic is still deemed necessary, consider an alternative that is not beta-lactam antibiotic, given the potential for cross-reactivity among these medications. Often may include macrolide, azithromycin, but should be selected based on suspected or confirmed pathogen occur, macrolide should be selected based on suspected or confirmed pathogen or local resistance pattern. Allergic documentation. Document the allergy reaction in the child's medical records for the future reference. Inform the caregiver about the reaction, advising them to notify healthcare provider of this allergy in any future medical encounters. When to seek further medical help, advise the caregiver to seek immediate medical attention if symptoms worsen or if new symptoms develop, particularly signs of a more severe allergic reaction such as difficulty breathing, wheezing, swelling of the face, lips, tongue, or throat, or signs of systemic involvement like dizziness or fainting. Prevention and education: educate the caregiver about recognizing signs of drug allergies and the importance of timely intervention. Discuss the avoidance of penicillin antibiotics in the future unless an allergist evaluates the child and potentially performs allergy testing to confirm the penicillin allergy or deem it safe to use. Long-term consideration: consider referral to an allergist for evaluation and potential allergic testing, especially if there is a history of multiple drug allergy or the reaction was severe. This can help clarify the child's allergy status and guide future antibiotic use. So let's know what we have read today. Managing amoxicillin and allergic reaction in children. Okay. Allergy reaction to amoxicillin treated by antihistamine like diphenhydramine or cetirizine. Likely to penicillin allergy, remove causative factors. Stop taking penicillin. Even if there are no other symptoms, you don't want to exacerbate them, as in some cases it can lead to anaphylactic shock. Assess and monitor patients to make sure their condition isn't deteriorating. Make parents aware of penicillin allergy to prevent it in the future. Rest should disappear in 24 hours of stopping amoxicillin propagation in the future to test for true penicillin reaction. For example, penicillin allergy associated with Epstein-Barr virus instead or respiratory tract infection. They started to relieve hives that HIV evaluating need for antibiotic in their respiratory tract infection needed change to another non-penicillin antibiotic, for example, cephalosporin. Management of urticaria following amoxicillin administration in a child, especially without other systemic symptoms, primarily involved discontinuing the antibiotic and providing symptomatic relief for the allergy reactions. Discontinue amoxicillin, administer antihistamine, observe for other symptoms, reevaluate antibiotic need, alternative antibiotics, for example, macrolides, azithromycin, allergic documentation, you went to seek further medical help, severe allergy reaction, prevention and education, long-term consideration. So immediate management, discontinue amoxicillin, administer antihistamine, observe for other symptoms, follow management, reevaluate the antibiotic need, alternatively antibiotic, allergy documentation, when to seek further help, worsening symptoms, prompt intervention, prevention and education. Penicillin allergy documentation, allergy evaluation, long-term consideration, allergy evaluation, antibiotic selection, include the macrolides, allergy documentation, child's medical course for further future reference, inform the caregiver about the reaction, advising them notify healthcare provider about allergy, urticaria, and amoxicillin allergy. Cause onset, other symptoms, respiratory tract infection, and antibiotic treatment, respiratory tract infection, amoxicillin, prescribed allergy reaction, providing alternatives and allergy evaluation, alternatively antibiotics.